Hey, what's up everybody? It's Dr. Brant Green, chiropractor here in Annapolis, Maryland. And today I'm going to be talking about one of the most common causes of neck pain, headaches, mid-back pain, and shoulder pain that I see almost every single day in practice. And I'm going to show you some simple ways that you can use at home to help get some relief. If you're new to the channel, please like, subscribe, and leave a comment down below. Let me know what you think. Let me know if you do suffer from neck pain, headaches, cervicogenic headaches, or shoulder pain, and what you've done to help try to fix it. In today's video, I'm going to be talking about the levator scapula. Did you like that drawing? Yeah, I did that myself. So what is the levator scapula? Well, it's a very small muscle, but has a big role, and it does a lot of different things. It originates on the superior medial aspect of your scapula. So if this were my scapula looking through my body, it comes from that top inside part of your scapula. It rotates 180 degrees as it goes up and attaches to the top 4 cervical vertebrae in your neck on the outside. So what does this muscle do? Well, as it relates to the shoulder and the scapula, its primary mechanism is to elevate the scapula and inferiorly tilt the glenoid fossa. What that means is it takes your scapula and lifts it up and rotates it down out from the outside to help get your shoulder into a position where you can be here. As it relates to the neck, it helps aid in rotation and a little bit of flexion. It also helps in extension with both of them activating at the same time. Your pec minor and your rhomboids also contribute to help getting your scapula into that position with serratus anterior. So why does the levator scapula cause so many issues? Well, it's because it's the most common site for trigger points. Due to all the different things that we do in our life every single day, almost all of us, it's little things like looking at a computer screen, going back and forth. Think of secretarial work. Or if you carry a purse, if you're a woman, you carry a purse on one side of your shoulder and you tend to hike that shoulder up to stabilize it, to support that weight, right? Or if you're even at like a basketball game and you're looking back and forth, if you were to sleep at night and shorten that muscle up while you're sleeping and then it spasms throughout the night and you don't know it until you wake up in the morning and then you get that pinched nerve feeling in your neck. These are all different ways that you can irritate and exacerbate these trigger points. Now, most of the time, for most of us, we have what are called latent trigger points or dormant trigger points. These are where we have those little muscle knots, but they're not irritated unless we poke on them. They don't necessarily produce symptoms that we feel day to day. An active trigger point is when that trigger point of that muscle knot becomes irritated or inflamed, and it starts to cause localized pain and referred pain. So it can cause pain at the site where that trigger point is, where the muscle usually attaches to the tendon into the bone, or it can also cause referred pain and refer out into the shoulder, refer up into the neck, into the head, and it can also refer down the mid-back through the scapula. The way I kind of describe a trigger point is if you imagine a muscle fiber and you have a few of those fibers in the middle that are bound up, they're irritated, they're locked up, they're knotted. If you were to palpate one, it feels like a little marble underneath the skin inside that muscle, and if you push on it, it hurts a little bit more than it should. It can also cause referred pain to go up or down or away from that site. We've all had them. We all have those little knots at our necks. They're trigger points. So how do we assess these trigger points? How do we know if we have them? Well, the first thing we have to do is we have to check things like range of motion. We have to do active range of motion and then passive range of motion, where we have someone like a provider run you through those same stretches to see if we can get more range of motion or less range of motion without the muscles actually contracting. We'd also check the shoulder range of motion and the scapular range of motion, things like Apley's test, where we bring your thumb up as high as we can in your lower back in one sweeping motion to see if your scapula is able to get into position, see if you can get your scapula mobilized, abduction and adduction of the shoulder, etc. We'd also do palpation, so we would actually get in there and use our fingertips as providers where we can palpate that muscle and see what's going on, see where the tension is, see if we can elicit a pain response, elicit that trigger point feeling while we were assessing it. And then also your symptoms, just your day-to-day symptoms, what you're having trouble with doing, if you're having trouble with reaching overhead without neck pain or back pain, if you're having problems with abduction or adduction of the shoulder, if you're having problems with flexion or extension, or if you have that, again, typical trigger point pain that kind of comes from the neck that a lot of us have after we wake up in the morning. So let's say you do have a trigger point in your levator scap. What is the solution? Well, the first thing we want to do is we want to stretch. We want to try to get that muscle to lengthen. We need to add length to it because it's shortened up, it's tightened, it's become irritated, and that's going to lead to the pain, the symptoms. It's going to cause scapular dyskinesia, which is basically dysfunction or dismovement of the scapula. It's not doing what it's supposed to, so we need to add length to that scapula, and then we need to stabilize it, right? So the first thing we would do is we would start by stretching it, actively and passively stretching that scapula and that levator scap out, working on the shoulder, working on the neck. And then we would also combine that with manual therapy techniques where we would use, my thumbs, or we would use tools like the hypervolt, or we could use cupping and scraping tools with the intention of adding length or mobilizing or stretching or getting those knots to loosen up. We would also want to address the joint complex. We want to address the joints of the spine and the scapula as it relates to the rib cage and make sure that those joints are moving. So that's where chiropractic comes into play. We're addressing the soft tissue and the hard tissue component as well as the nerve. A combination of those therapies helps most patients. Just the addressing of the soft tissue and the joint complex, getting them moving again, are going to help most patients get out of pain. And then we would add in strength and stability exercises to help stabilize that scapula into its new position, into a healthy position, so then these issues don't keep coming back. And that's just teaching you how to use your shoulder and move your scapula in a way that it's designed to. This usually involves strengthening of the serratus anterior, upper trap, and lower trap. In some cases, manual therapy and chiropractic aren't enough to help someone get out of pain and free up that trigger point to help get that levator scap doing what we need it to do. And so then there are other measures you can take to work on those trigger points, things like trigger point injections under ultrasound, where someone might receive lidocaine or marcaine injected into that trigger point to help decrease pain very quickly, and then also add some length to that tissue. And then that allows providers like myself to go in and build off of that and work on it even more to add that length in because the patient can now tolerate it. So before you go, I want to show you a quick stretch that you can use at home on your own to help add length to that levator scapula. There's a couple different variations I'll show you. If you're having neck pain on the left side and you suspect levator scap might be involved, you're going to start by placing your hand on that shoulder, the affected side. You're going to get your elbow up as high as you can. And what this is doing is it's pulling the scapula down. It's depressing the scapula. And then I'm going to put my other hand on top of my head and passively stretch my neck into flexion away from the affected side. You want to hold that position for at least 30 seconds and make sure you're breathing as well. A little tip that you can do to add some variance into it is to get into the flex position, breathe through that for 30 seconds, come out of it slowly, and then go back into that position with a little bit more rotation towards the affected side of your chin and your face. Hold that, and then come back out of it, and then rotate slightly away. Hold each of those for 30 seconds. What we're trying to do is we're just trying to get some of the different layers of that muscle and some of the other affected muscles around it and add some variance in there. There's a lot of different angles and articulations of the fibers and how they attach. Everyone's a little bit different. And so we want to try to get as many of those fibers, affected fibers, involved as possible. Now, if you struggle to get into this position because of shoulder pain or arthritis, or it's just too much, you've got impingement, something's going on, you just can't quite get it up there, the goal here is just to get the scapula down and stable. So another way that you can do this is to take your hands, put them by your side, and just push your fingertips towards the floor. Concentrate on your back. You don't want to concentrate on your chest. You want to concentrate on your back and put your fingertips down towards the ground. Get that scapula low on your back, right? Think about putting your scapula in your back pocket and then do the same stretch. So hold those again for at least 30 seconds. Do both sides. You can do this once, twice a day. Try it for a couple weeks. See if it makes a difference. Other ways that you can help mobilize this tissue are to use things like mobility tools or a lacrosse ball. Lay on the ground very carefully or against the wall. Place that lacrosse ball in that trigger point or in that knot, and don't just lay on it. You can start by laying on it for 30 seconds to 2 minutes to try to get that to free up. Don't go beyond 2 minutes because it has a likelihood of exacerbating or irritating the area and making things worse. So don't go beyond 2 minutes. But you can do a passive mobility where you're just applying pressure into that trigger point and getting it to release. The other way is to do an active release where you're actually going to be applying pressure to that trigger point with a tool and then running through ranges of motion with the shoulder. One of the main ones that we do is that we teach patients is to just do flexion and extension of the shoulder and then adduction to abduction. And we're just trying to shorten and lengthen that levator scap with that pressure on the trigger point. And what that'll do is that'll get that trigger point to let go. Make sure you're breathing while you're doing these. So let me know if you've done any of these stretches before, or if you've tried any of these mobility techniques before. Leave a comment down below. Let me know what you think. Let me know what your feedback is. Do you have neck pain? Do you have headaches? Do you have headaches that you think are coming from your neck? Do you have problems with your shoulders or your scapula? Are things not moving the way that you want them to? Let me know what's going on. If you're in the Indianapolis area and you'd like to be checked more thoroughly, use the link down below. and I can offer you a consultation. We can come in and see what's going on. We've got some great new patient specials. I'll put a link down below for that as well. Come in and be seen. If you have other videos that you'd like me to produce or put together, other stretches, other areas of concern, again, leave a comment down below. Let me know what you think. All feedback is welcome, good and bad. I hope you guys enjoyed the video as much as I loved making it. Please, again, let me know what you think. Stay tuned for more content. Subscribe to the channel, like this one, share it, pass it along to your friends. All of us experience this kind of neck pain or discomfort at some point through life. So that's it for this video. And as always, take care, stay healthy, and check back soon for more content.